Hello everyone. Today in this video we will see what are the tumors of the salivary glands are. దీని తెలుగులో మనం లాలాజల గ్రంథి కణుతులు అంటాం. So in order to understand the tumors, we will try to see what are the salivary glands, how many salivary glands are present and what is their function. So there are major salivary glands and minor salivary glands. The major salivary glands are 3 in number on each side. They are the parotid gland, the submandibular gland and the sublingual gland. So one is present below the ear lobule on the side of the cheek, one is present below this bone mandible, and one is present below the tongue. So connecting them to the mouth or the oral cavity, there are multiple small pipes. So for parotid gland we have a Stenson's duct, for submandibular gland we have a Wharton's duct, and with multiple openings this sublingual gland will open into the oral cavity. Now what is the function of these glands? As the name suggests, salivary gland. So it is some structure which is producing saliva. Now why the saliva is important? Because saliva is important for lubrication, which helps in respiration, which helps in speaking, which helps in digestion or taking the food inside the oral cavity and into the stomach. Now how? Did you ever run? So once you start running, you will try to open your mouth and breathe, and then the entire mouth will go dry. So after that what do? You take a glass of water, you drink a glass of water, or you try to bring more saliva into your mouth and just try to lubricate, right? So this lubrication, that is why is important for respiration, for swallowing food, okay, or even for speaking. Because you start speaking for long time, you take a break, you will drink some water, or you bring that saliva into your mouth and then you start speaking again. So apart from this, it will have some antibacterial properties, antibodies, and also some kind of digestive enzymes which will start digestion as soon as the food is taken into the mouth. So why this is more important is, you might have seen some people who are taking radiation therapy for head and neck. So in those patients, the entire mouth will go dry because the gland is also subjected to radiation and there is decreased secretion of saliva. In those patients, it is very difficult for them to swallow food or speak, even for that matter taking respiration. Now what are the diseases that arise out of the salivary glands? We are more concerned about the tumor in this video, but however there are some non-neoplastic or non-tumorous conditions, like there is infections like mumps, then chronic sialidinitis, like you have parotitis, there is tense swelling of the parotid gland, tense swelling of the submandibular gland, then there is formation of pus or abscess inside. Okay, in small children you will also see some kind of arteriovenous malformations which are structural deformities. Okay, then there might be formation of small stones in the ducts. So this pipe which is present, which is connecting the gland to the oral cavity or mouth, in that there is formation of small stones. If the stones are very small, then with the help of endoscopy we can remove those stones, silendoscopy. But however, when the size is more than 6 millimeters or 8 millimeters, then it is very difficult for us to remove them. In those cases we usually try to do a conservative management, but however if the conservative management fails, then probably we'll have to excise the gland. And whenever the stone is present in the tissue of the gland, then most of the times excision is required. So whenever we tell you that you have a tumor, don't think that it is cancer. Okay, all tumors are not cancers. Okay, so in this we have benign tumors which are non-cancerous tumors and malignant tumors which are cancerous tumors. Now first we will see what are these benign tumors. Benign tumors are basically these tumors, they are not cancers, but however there is growth. So you can see in some people that there are well-defined lumps over the face. Sometimes even they grow up to the size of another face which is hanging around from the cheek. So in those conditions, usually surgical management is only required, and once you surgically excise that tumor, then there is no need for any other treatment. So in most of the major salivary glands, the benign tumors are pleomorphic adenomas or Warthin's tumors. The outcomes of the surgery is also good. Now, when it comes to malignant diseases, we have multiple histopathologies of these salivary gland tumors. They are categorized into low grade and high grade tumors according to WHO 2017 classification also. Then as per the grade of the tumor, again the treatment management also changes, whether we'll have to address the neck also, whether adjuvant treatment in the form of adjuvant radiotherapy also should be given after the surgery. So there are multiple factors to it. Let us not get confused with all those terms and things. So sticking to the basics, in order to come down to a diagnosis and know the extent, we'll have to do two things importantly. One is needle test or fine needle aspiration cytology test, which is known as FNAC. Okay, with this almost 90 to 96% we will come to know what kind of tumor we are dealing with, whether it is a benign tumor or a malignant tumor, then in malignant tumor what kind of malignant tumor and all. Now next thing is we will try to identify what is the extent of the disease, what are the spaces which the disease has extended up to, and whether there is simultaneous involvement of any lymphadenopathy, that means cervical lymph nodes are also present sometimes. So should we address that also? So all these things are taken care by doing a cross-sectional imaging. So in parotids, because it is a soft tissue tumor, I mean it is not associated with any bone and all, we will try to go for a CE MRI. But however, once the imaging is done, we will know the extent, and once the FNAC is done, we will know the type of the tumor. So combining these two, we will try to stage the disease. As per the staging, we will tell you initially whether you will have to go for only surgery or surgery with adjuvant treatment also. That we are dealing with these tumors which are present over very sensitive structures. Here in parotid we have facial nerve, that is a nerve which is rising from the brain, which is coming through your ear and which is passing through the tissue of the parotid, and it is branching and giving multiple branches to the facial muscles, which helps you in facial expressions. So once if this is damaged during the surgery, then probably you will land in something known as facial palsy, where after the surgery something like this will happen, where this half of the face doesn't work. This might be temporary or this might be permanent based on what kind of injury or what kind of tumor we are dealing with. Prior to the surgery, if the facial nerve is not functioning, that means at presentation itself, if your half of the face is not functioning, then probably even after the surgery we cannot revert it back, because that non-functioning facial nerve implies that the tumor has infiltrated into the nerve. Okay. So during the surgery, we will have to cut that nerve and see that there is no tumor remnants inside the body. Now after cutting, we will send this specimen to frozen section, that is intraoperative frozen section, where a pathologist will tell us whether the cut ends are free of tumor or not. Once we will get the report that the cut ends are free of tumor, then what we try to do is, on the same sitting with the same incision, we will try to harvest greater auricular nerve and we will try to put a cable graft. Now if that is not possible, then we will try to take sural nerve from the leg and try to put a cable graft. Okay, that is the best thing that we can give you on table. Now after doing this, these are microsurgery basically. So after doing all these things, we will try to fill the gap also with the help of some fillers like dermal fat and all. Now the final histopathology will come, and that will dictate whether you will require any kind of adjuvant treatment or not. So if it is a stage 1, stage 2 disease and the disease is low grade, then definitely you will not require any kind of adjuvant treatment. But if it is stage 3, stage 4, or if there is involvement of lymph nodes, or there is high grade tumor, or it is a recurrent tumor, then probably you will require adjuvant treatment also. That means you require surgery, but along with that you will require some other treatment in the form of adjuvant radiotherapy. As far as the evidences that are available by today, there are no concrete evidences that adjuvant chemotherapy is also required along with radiotherapy. So usually in these cases we will only ask you to undergo adjuvant radiotherapy. There are two things. One is sequelae of surgery. That means every surgery will have to go through some things. So after surgery you will have a scar, then you will have a dip. I mean, the skin flap which is raised for doing surgery, it will stick back to your tissues inside with the help of fibrosis. So there will be some amount of altered sensation over that skin also, which is known as paresthesia, and then sometimes you may lose some sensation over the ear lobule. That paresthesias will be present. So these are all sequelae of the surgeries. Complications, as you know, every general surgical procedure, I mean whenever you are using a surgical procedure or an intervention, there might be some complications which can be anticipated, like surgical site infection might be present, then the healing may be compromised because of multiple factors. If you are a diabetic, you are a hypertensive, where we cannot give you multiple drugs, or you are deprived of nutrition, then we'll have to pump you with multivitamins and all, then the healing process will come down. Okay, now apart from this, the major complications that we come across is, as far as parotid is concerned, the facial nerve palsy, and as far as submandibular gland is concerned, there might be a mouth deviation. That means there is damage to this marginal mandibular nerve, which is again a branch of facial nerve. Multiple treatments also for this facial nerve palsy. There is dynamic rehabilitation or static rehabilitation. As per the requirement of the patient and the feasibility, we can take up these cases for rehabilitation as well. We have Frey syndrome. Frey syndrome is something where you are taking food, right? Then instead of producing saliva, this skin will start secreting sweat. Okay, this is known as gustatory sweat. If you want to undergo surgery, do it at the earliest, because when you undergo surgery, whenever the lesion is very small, you have multiple advantages, like the surgical time is less, the incision will be small, then the complications will be less, the hospital stay will be reduced, and definitely